Assalamualaikum. Alhamdulillah, with His blessing, we are able to organize IIUM Industrial Webinar 2021 under the Knowledge Transfer Program entitled Empowering Sexual Health Knowledge in Sheltered Home During COVID-19 Pandemic. Before that, we appreciate your cooperation to follow our IG Oilcast, follow our FB Industrial Links IUM, and subscribe our YouTube channel Office of Industrial Links. Don't forget to fill in attendance Google form and also survey of this program. We need your feedback for our improvement. Our speaker today, Dr. Siti Hazariah binti Abdul Hamid, is an assistant professor at the Kulliyyah of Nursing IUM Kuantan campus. She is the head of Clinical Center Kulliyyah of Nursing. She obtained her bachelor's degree from University Science Malaysia, master's degree in Community Health Science, Family Health from University Council Malaysia, and PhD in Nursing from University of Manchester, United Kingdom. She has keen interest in issues related to young people, health and well-being, sexual and reproductive health, critical discourse analysis, and qualitative study. Dr. Hazariah is the recipient of category grants for the year 2019. Without further ado, I may now invite Dr. Hazariah. Please, Doctor.
Okay, Assalamualaikum everyone. Thank you, Madam Fariza, for your kind introduction. Thank you also to Oil for inviting me for this sharing session on the empowering sexual health knowledge in sheltered home during COVID-19 pandemic. Okay. These are the outline of my presentation. I will talk about what was the motivation for this project, why we focus on the empowering sexual health knowledge, and why we focus on the caretakers and adolescent in one of the chosen sheltered home we call as Darul Anisah Kuantan, and how we did, what are the variables that we are using, and I want to share with you the challenges during COVID-19 pandemic, because this project is started early 2020, and how we overcome during the COVID-19 pandemic. Okay, and lastly, I would like to share the take-home message for especially for the new leaders and also others who are going to have a community engagement project with the community. Okay. And the motivation for this project, as mentioned by Madam Moderator, is actually continuation of my PhD topic on sexual and reproductive health among adolescents in Malaysia. It's actually what called me to focus on this topic because of the unintended adolescent pregnancy and also the baby abandonment, which are become a serious public health issue in Malaysia. Sheltered home, the establishment of sheltered home, adoption process, early marriage are among the initiatives taken by government and non-government. Okay, what I found is lack of published information about contraception and safe sexual practices delivered to unmarried adolescents in Malaysia. Healthcare provider and the caretakers that are work within the policy and guideline in providing information on sexual health and also the services to young people. However, from the finding of my study, I found that the cultural and religious belief has creating a dilemma which give an impact on the ability of the healthcare provider and caretakers to provide the accurate sexual health information to the adolescent. Okay. Actually, why we choose Darul Anisah Kuantan is actually from the word of mouth, and also I search from the Facebook to see what are the routine activity and what they did. So from that, we got to know that Darul Anisah is a accommodation for the disruptive girl. Actually, some of them come from the broken family. They are involved in pornography addiction, involved in social activities, engaging in sexual outside marriage, and end up with the unintended pregnancy and have a history sexual and physical abuse either from boyfriend or family members. And Darul Anisa Kuantan also act as a safe place for the unmarried pregnant mother to continue their pregnancy. Okay, after I've get all the information, I call and have a series of phone conversation with a manager and the chairman of this organization. Um, their routine activity is actually mainly focused on the strengthening moral and religious aspect. They are focusing on the teaching the adolescent how to perform prayer and reciting Al-Quran correctly. They start with zikir, solat sunat, and also understand back what is the meaning of life. So uh, we also can identify the problem with the this organization is all about the unstructured or semi-structured program, and the caretakers all are not well trained. Perhaps they have no opportunity, and they have also lack of evidence based on the health component in their daily routine, and also lack of focus on the health and hygiene. Okay, so from that, we think that as a academician in health campus, so we what we could offer and what we can give benefit to the this like what we call the deprived group. So we think about empowering the caretakers and adolescents with the sexual health knowledge and skill. So from that, we plan to establish or develop integrated sexual reproductive health module for adolescents as a strategy to prevent poor sexual health outcome. We don't want them to come back to that organization to reside there. For your information, they have to be there in Darul Anisa at least 1 year. Okay. About the KTP Sustainable Development Goal, we focus on goal number 3, good health and well-being for the adolescent. So we think of the themes that we are going to apply throughout the project. We choose behind every successful woman is herself. So these are all my team members. They are very dedicated. I have Dr. Haliza. She's expert in community-based rehabilitation and also women health. Dr. Bisha Fathama, she's from Kulliyyah of Pharmacy, and also Dr. Associate Professor Dr. Lokman. So each of us have our own different role, and basically we are focused on developing the module and become a speaker or what we call instructor during training the caretakers and the adolescent. Okay, and we also reviewing the module and the training slides that we plan to produce. Okay, for your information, Dr. Bisha, she's the president of Malaysians Against Pornography. So each of us have, I think, our own strength to contribute to the successful of this program. Okay, the project output and the impact to the organization. Actually, we want to support the services given by the caretakers in delivering optimum sexual health content. We want them to improvise. We help that. We hope that we could improvise services by integrating the module and training material in their routine activities, and at the same time, this is the great opportunity for us as the academician to go outside and have a networking with Darul Anisa organization, and also is actually coincident that we have like a third party for the networking, the medical officer and also the NGO organization, which is MAP. Okay, and the most important is actually to improve the quality of life in terms of knowledge, awareness, and in terms of providing services to the organization. So the impacts to the organization is the caretakers and adolescents, they are more creative and competent in delivering or handling sexual issues that they face in that organization. We also produce materials and video that can be used as a reference, and also community engagement between academician and community. We are supporting the objective of the university, which is sustainable development goal number 3, to ensure good health and well-being of the adolescent. Okay, we divided our project into several phases. I can say that it's 4 phases. First, we have a meeting between the academic and caretakers. For the first meeting, the most important, I think, we have the consensus what are the roles of each what is the role of organization, and what are the roles of the academician. So we got the picture, and then we also take the attendance and produce the minute meeting for our record. Okay, they are also for each activity, you can go to Darul Anisa Facebook. You can see that all the pictures are uploaded there. Okay, these are the first phase that we go for the visit and meeting in January. It's actually before the MCO, MCO 1.0. Okay, and for the first visit, we only can have a meeting between caretakers only, and all the secretary, all the AJK for the Darul Anisa. So we plan to have a follow-up visit. We want to meet personally or in person with adolescent residing Darul Anisa. So for this, we want to understand what are the issues. So we do the like a case study, we interview them, and we have a small group discussion. We want to know what are their health needs. And from that, we got to know that they really want to know about women health, sexual reproductive health, the hygiene, about the stress management, how to improve their self-esteem, how to handling baby, because some of them are pregnant and some of them already delivered and confinement with their baby at that sheltered home. And they also want to know about the life skill, about infant choking, first aid, CPR. Actually, these are the requests from them. It's not in the our proposal initially, because I think we agreed to add on to the current project, because we have as a Kulliyyah of nursing, we have like mannequin, we have disposable items, so we can lend or borrow from that, and then we bring there for the benefit of that group. Okay, these are some of the pictures attached. Okay, so we conducted CPR, first aid, and infant choking. This one involvement with the involvement of some of the my student. So it happened on 6 March, not yet MCO. So we start the first MCO on 18 March. Actually, we have like on 20 March another program to be conducted, but due to the MCO, we have to postpone our plan. Okay, for the second phase, we go to the second phase. I think for this time is actually happened during March 2020 and July 2021 during MCO 1. Actually, second phase should be the implementation of the workshop. So we want to train the caretakers and the adolescent to understand the content and skill required in the module. So basically, we want to have a seminar exhibition that focus on the factors that contributing to poor sexual health outcome from the health perspective. We want them to know the prevention strategies and the role of healthcare system for the early detection in supporting and managing the sexual health problem. And also, we plan to conduct a training and a workshop for the awareness focusing on the well-being. So we focus on physical, mental and spiritual health. And also there are some activities planning, for instance, screening for adolescent girls with any problem. We are using the form, and also medical checkup, breast self examination, those that related with the sexual health. Okay, because of the MCO, we can't do the we can, what we can do is we change the plan. So we focus on the module and training slides development, and also revise and um, critically the content of the module that we um, uh, develop. Okay, still, when the MCO like quite okay, and then we in August and September we start the program planning. So we revising again the prepared modules and the training slide. This one I involved the discovery nursing student. Luckily, we have like a few students that enroll in elective course that will actually elective course offered is related to young people health. So they are basically learn together with the academician how to give support or to give community engage, to do the community engagement. Okay, these are the module that we produce. Module 1 until 4, we have 4 module. Module 1 is about the remaja sihat, and module 2 Islam and uh, kesihatan reproduktif, and also pendidikan kesihatan seksual and sistem pembiakan. And if what if sekiranya the remaja have the problem, where they should get the help. Okay, so for the program implementation, actually we did in 2 months, November to December, we managed to have like 4 series of program. Okay, for module 1, health talk on healthy adolescent by myself, a medical checkup with the help with the student, and also we have a small group discussion. Okay, for the module 2, actually a few weeks after that, we conducted sexual and reproductive health from an Islamic perspective. This one, the speakers are Dr. Bisha. She's good at the preventing pornography addiction. So they are really enjoy. We did some quizzes, and also this one, the medical officer from Clinic Asalam nearby, Indra Makota, also joined us. Okay. For module 3, this is the main content of the whole project, which is the topic covers sexual and reproductive health and also breast self examination. This delivered by me. Okay, and we have module 4, the role of healthcare professional, and also the screening form. From that screening form, we can identify what are their problem, and also we have like a small group discussion to help them how to overcome their problem. Okay, just right after we finish 4 modules, and it's actually we entered to the MCO 2.0 in January 2021. So actually for the third phase, we want the caretaker of Darul Anisa delivered the talk on the health component on the adolescent by using the training slide that we are given them. And the adolescent girls, they can refer to the booklet, to the module that we give as for their reference. But for this one, we actually want to observe how they deliver, but we can't do because of the restriction of being there. And the fourth phase, it should we prepare report on the pre and post assessment For both caretaker and adolescent, the test mainly assess the level of knowledge before implementation of the module, and we compare to the after the program completion. And for this, we conduct the phone interview, and also I ask them to give a written feedback. Because initial plan, we want to conduct a small group discussion. I think the small group discussion face to face, and they are more like we can see their reaction, so we can go in depth. However, due to MCO number 2, we just can do the phone interviews to understand what are the benefit of our program, what are the shortcomings, what are we can further improve on the module that we provide to them. Okay, this is the challenges. As I mentioned just now, we should have a program on 19 March, but it was postponed. So we changed the plan. We focus on the preparation of slide module development and do the revision. And we plan again in August and September, also preparation of seminar kits to give to as a material during the seminar. And also we have like 2 months for the 4 series of main program. And also in January, we, as I told you, that we just only focus on the phone interview and gather the written feedback. We also decided to send for the copyright or intellectual property submission and final report, because this program, it should be settled within 1 year. So we think that we should change and ensure that the program is successfully done. And overall, we managed to conduct 8 sessions, and for the face-to-face and many phone interviews lah. Okay, for other challenges, limited number of, this one during the implementation, November and December, until December, actually we only go a limited number of academics, and the student were allowed at one time. We only bring 2 students to help us on the registration, distributing the pre and post evaluation, and also assisting us in the related activity. So we need also to follow the SOP, wearing mask, hand rub, temperature taking, physical distance. For your information, as you can see from the picture just now, the space is really limited. Sometimes we are using we are used outside house to conduct the activity, and it should be within the limited time. And this one is, I think, the big problem for us, which is Darul Anisa, they are not equipped with Wi-Fi. Only caretakers have phone. The adolescent, they don't allow to have phone. And online seminar or health talk were not convenient for this organization. So we, after the IP submission, we plan to close the grant in April, and it's granted in July 2021. Okay, I think want to share what are the take-home message that new leaders or new team that can apply from our experience is you should have like as a PI, we should ensure the active involvement from the team members. Each of them should be assigned their roles, and we should monitor and get the feedback. So each program, each session that we want to conduct should have a detailed proposal, the tentative and the budget should be approved. We should think on the contingency plan. The creativity is paramount during the pandemic COVID-19. We really need the creativity, and we should think out the box. For instance, online training, video making, or we can send them the seminar kit if we can't go to their organization. Okay, we should have proof of attendance. For me, we do it manually, and I think you can also give like for example, Google form and um, pictures is very important for the proof of the program. Pre and post evaluation report we should compare, and then do the analysis and give the insight. Okay, and uh, not to forget about the periodic progress report every 3 months, and report on feedback from the industry or community. This is very important as well. There are part for them to fill up and sign, and then this also very important. I want to you to have a proper filing and documentation. Now I think the convenient is we are using the Google Drive, and for the intellectual property, for instance module, training slides, video, you need to apply early as it expected to take sometimes because of COVID-19 pandemic as well. And then um, this is for the project, but for the personal or career development, I think this is my opinion, and I think there are a lot more that you can achieve. That we should ensure that our project give impactful contribution or like benefit or community engagement. We want them to use our module, our developed module, training slide and videos to improve their knowledge, competency of caretakers and adolescent in sheltered home. This one is like a pilot project only for um, one organization. Perhaps if we can apply to another organization, or we can collaborate with Jabatan Kesihatan, Jabatan Kebajikan Masyarakat, either we want to replicate or we want to have like more um, outreach to other organisation. And uh, this project is supporting and contributing to the university objective of SDG, which is transfer knowledge and life skill to the community. And from this, I actually able to develop a new course outline for young people health. Actually, this new course outline meant for the undergraduate student to prepare them how to go for the community engagement, and also know about the um, young people health. Okay, just now I forgot to mention about all the module that we prepared. Is actually we are using Canva software. You also can purchase to have like a Canva Pro. For us, we just like use the free one. Okay, I think that is all my sharing on the project. Uh, I think I should pass back to the Madam Moderator for any question, and thanks for listening, and thanks also for all and University Islam Antarabangsa for giving me the opportunity. This is actually my first grant after coming back from the PhD in 2019. Okay, thank you.
Thank you, Dr. Hazariah. We are now open for question session. Please, you can post your question. Yes, we have one question from Sister Siti Juraida Selamat. Doctor, how do you ensure the sustainability of the project? I think
Okay.
this is referring after completion of project.
Oh, okay. Actually, sustainability is very important to me. Based on the networking that we have established, we can also think for other opportunities. We it's not one off. We still after 1 year or completion of the project, we should uh, like uh, what we call them, visit them, and we can also replicate, as I told you just now, replicate to other organization based on the feedback or the reflection that we got from the first project, because this is like I consider as um, a pilot project. It's very important. Impactful and sustainability is very, very important. Okay.
Maybe I should add some more on the, yes, we have another one question, Doctor, from Madam Siti Nor Kairina Sotali. Yes, what is your biggest challenge while conducting this study and how you overcome it? Yes, during the MCO, how do you overcome it?
Okay. I think as I told you a few times, this is my first project, so I learned I think a few mistake lah. I've made. First of all, the first before MCO, we have like a plan. We have a proposal approved and we have prepared the seminar kits and everything. We the biggest challenges is uh, start uh, March until July, until June, we just focus on the the material development. We forget about what we have did before, and the report I've sent, but in term of financial report and everything, it's just like put aside until the receipt and everything is not valid anymore. So it's cost about like 5 to 900, I think. It just like from our team, so we just like give them macam our contribution lah for the first few month. And then how to overcome it, I think as a team member, a project member, we should like have to remind each other what are the timeline, what we have achieved, what we should do, and the proper documentation. That is the first challenges. The second challenges is this: the place quite small. We have to have like a physical distance. As you can see, it's very difficult because is but I think during that time MCO1 is the cases is not bad as now, so we just like physical distancing tu macam quite it's not really applied, but we try to do it as best as we can lah. Okay. And I have like this is my um opinion as well about the creativity. I think my team member, they are so creative. They give me that we always have like a discussion how we should what we can do, and we can follow the timeline. So many uh, amendment or change of plan is done throughout the project to make sure that it's successful and achieve the objective.
Meaning that you have to adjust accordingly, yeah, Dr. Hazariah, due to
Yes,
pandemic.
yes, true. We can't like put the 100% on the MCO that okay, we can do this, we can do that. We cannot, because in the report there are some like if there is a changes, we can report and why, what we did. Actually all is very like flexible to not to rely really 100% on the proposal that we send throughout the project. Actually there are some changes and opportunities coming, so we should think creatively lah.
Yes.
Okay,
Any other
thank you,
question?
Karina, for the
Awaiting
question.
other question? Yes.
Okay, the module can be accessed to anyone. Okay, actually, for the module, we are not, we are just for the copyright. We just send for the training slide. For the module, we actually plan for the ebook. It can be accessed because it's have a reviewed few time. Perhaps we have like because it's for, I think 100 pages something lah, we produce that. So we have a plan to produce like a ebook or book or apply ISBN, but it's still in the process. So to be accessed by anyone, not yet, but for you, if you want to have like a, mm, apa tu reference, you can always you can freely call me or email me so I can share with you. As of now, it's just like give to the participant,
Okay.
not yet to be accessed by anyone, but I can give actually. It's information
Okay.
sharing.
Next question, please. Yes, it's a
Okay.
good information for all project leaders and anyone who plan to apply for the next grant.
Yeah, actually, I applied. This is my second application. My first application is like it's not like perhaps not. It's one off project. So I learned from mistake and did another proposal. So we the second proposal, alhamdulillah, was approved, and we really excited to conduct it, and we managed to do it within 1 year and a half lah to complete the grant, the KTP grant. It's actually is a good opportunity lah, good opportunity given
Yes.
to the academician in URA. We should grab because I think the impactful contribution, the course outline, or the is actually one of the some of the for the career development lah, and also for the promotion.
Next question, please. I think there are people who keen to ask question. Yes, Sister Nur Shahira. Assalamualaikum,
Uh,
Doctor. How do you manage between your teaching life and managing the project? Yes. How you manage it?
okay. First initial tu macam quite it's difficult for us lah. I think to have 8 project 1 year is time consuming. It's a lot of effort. How to manage between teaching life, teaching we have like a fixed schedule. So as the academician, we have like a flexible hours. So normally the meeting we did Friday afternoon. I think we have like one time went there during weekend, but the rest I think Friday, Thursday, because we also need to uh, it's not about our schedule ourselves, but also their schedule at the sheltered home. It's not only us that went there for the community engagement. There are other parties also went there to provide the like what we call services or to support them. So for us, we are focused on the health of the adolescent, which is only us lah for the health part. So we got like a good cooperation from the chairman and the uh, supervisor, caretakers from the organization. We are still contacting, and they are asking when to come again, and we are actually looking forward lah. But because of now the MCO3, we don't have any chance at all to go there.
Any other question to Dr. Nur, Siti Hazariah? Yes, Sister Zurada. Thanks for your question. Doctor, this is my question. After completion of a program, do you have any other plan? I mean, do you have any other plan with Darul Anisa? Since you said that they are still keep in touch with you for maybe for the next project.
Yeah, actually the chairman and the supervisor, they actually the manager in the Darul Anisa, they are looking forward to have like other perspective. So we are now previous project we're focusing on the sexual health. So they want more on the mental health, on the spiritual health. So we are actually want to go and like give one off. We don't want like we want the project is sustainable even its completion. We it depend on the request, especially on the health part lah, health component. Although it is not focused on the sexual health, perhaps on the other health component. As a nursing background, a health background, we can give anything that meets the needs of the caretakers and adolescent there, as long as it benefit them and they apply on their daily life.
Okay, doctor. Actually, my question, how do you manage the grant, doctor?
uh, uh, how I managed the grant because 2019, 2020, I don't have any other grant unless I just be a co-supervisor or a co-investigator, co-researcher for other projects. So I just focus mainly on this KTP project. And how to manage is actually instead beside referring to the previous leaders, and I also closely work together with oil, which is with you, madam. You know how frequent I contacted you, but
Yes.
I'm not rely to the third the second the third party information. They just go directly
Yes.
asking oil what to do, what the list that I have to uh, the correction. Even I did the correction based on the request. And then um, is a lot. I think there are many parties lah yang help me to manage the grant, especially my team member as well.
Okay.
Good team member. I think personally we couldn't work in silo. We should like ensure their involvement and their contribution lah, because they are expert in their own field. So alhamdulillah for that good team member, and also good uh, guidance from oil.
Okay. I would say the conclusion is a good team member and cooperation from other parties. Yes, we have other question from Sister Madam Shakira Iqbal. Assalamualaikum, Doctor. May I have your perspective on termination of pregnancy, especially in cases of underage pregnancy where it may harm the mother? Wow, this question.
Actually, as you know, that termination of pregnancy is only allowed for certain criteria. It's under the under the purview of medical officer who if the pregnancy comply with certain criteria. For instance, it will harm the mother, will harm the um I can't remember, but there are four criteria. If met the criteria, the termination of pregnancy can be done. However, in our cultural, in our like religious and cultural, in Malaysia, it's actually difficult to be done lah. Normally, what happen to young people, they reveal their pregnancy quite late, after 3 months. Normally, if below 3 months and they met the criteria, the pregnancy termination of pregnancy can be done. But normally they reveal the unmarried pregnancy, they reveal to their parents or reveal um, to others about the pregnancy too is in the late stage. The termination of pregnancy is impossible to be done. So they end up being in the other place, not their at their home. They enroll in the organisation, in the sheltered home, rumah perlindungan. So we have like government and non-government. So parents will send them because they are underage. So with the consent of parents, they will be staying there for until at least they're delivered, or they plan to take care of the child themselves, or they end up with the adoption process.
I think the topic is so interesting, especially in the current era whereby we are facing underage pregnancy, underage marriage. Can doctor? And then
Yeah.
any other question from the members, from the audience? Wow, this is an opinion from Sister Juraida. Because sometimes people in general think sexuality is a taboo topic. Yes, it's a taboo topic to talk about when we only need to know when we reach a certain age.
Yeah, I agree with Sister Juraida. Actually, it's a still taboo. Even us, as a mom, how we want to talk or we want to teach our children, the grown-up children, about sexual health when they ask us, or how we want to deliver correctly the information to them. So I think it's very challenges for mom, for the healthcare provider as well, and for anyone lah in Malaysia. But I think we should thinking about the problem, the problem of unintended pregnancy is actually is preventable. They shouldn't end up getting pregnant unintendedly and end up being in the sheltered home. They should be in with their friend, enjoy the college, school, but it shouldn't be like a hidden pregnancy, but it's taboo lah. It's difficult, but we need to challenge.
Okay, one last question from the members. If there's no other question, to all viewer, please don't forget to fill in the attendance, and then don't forget to fill in the survey form for our future improvement. And of course, don't forget to follow our FB, our IG, and subscribe our YouTube channel. Thank you very much, Dr. Siti Hazariah, for your time, for your patience for this project. Hopefully, we can work together in future, inshallah. Thank you, everyone.
Thank you.